Your kidneys are filtering your entire blood volume right now. Not over the course of an hour or a day, but every single minute. They're processing about 180 litres of blood every 24 hours, removing waste products, balancing electrolytes, regulating blood pressure, and producing hormones that control red blood cell production. And they're doing all of this completely silently. There's no sensation when your kidneys are working, no feeling when they're struggling, and critically, no pain when they start to fail. By the time most people realize something is wrong with their kidneys, they've often lost 70 to 80% of kidney function. At that point, the options become dialysis or transplant, and the damage is permanent. But kidney failure doesn't happen overnight. It develops over months or years, and your body sends warning signals long before you reach that point. The problem is that most people don't recognize these signals for what they are. They dismiss the symptoms as normal aging, stress, or something unrelated. A bit of swelling in the ankles after a long day, feeling more tired than usual, needing to urinate more frequently at night, changes in how food tastes. These seem like minor issues that aren't worth worrying about. But they can be early indicators that your kidneys are failing, and if you catch them early enough, you can often slow or even stop the progression. Miss them, and you're on a one-way path to end-stage renal disease. There are 6 specific warning signs that your kidneys are in trouble, and if you understand what they are, why they happen, and when to take action, you can protect your kidney function while you still have time. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years working in the AANDE, I've seen what kidney failure looks like in its acute and chronic forms. I've treated people in pulmonary edema because their kidneys can't remove fluid anymore and their lungs are filling with water. I've managed hyperkalemia, which is dangerously elevated potassium levels that can stop your heart, because failing kidneys can't excrete potassium properly. And I've watched people start emergency dialysis because they waited too long to address kidney disease that could have been managed if it had been caught earlier. My goal now is to help people recognize the warning signs of kidney failure before it becomes irreversible, because early intervention can add years or decades to your life. Now, I know that's a serious claim, and you might be wondering whether this channel is worth your time. So let me make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in the latest research and clinical evidence, to help you understand what's happening in your body and how to protect your health. I'm not here to sell you kidney cleanses or supplements. I'm here to give you real information that could save your life. All I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you don't think it was worth your time, or you haven't learned something genuinely useful, then feel free to unsubscribe. No hard feelings whatsoever, but if you give me your time and attention, I'll give you everything I've learned from over a decade in medicine. So please help me out. Hit that subscribe button to help this channel reach more people like you, and let's continue with the video. Before we talk about the warning signs, you need to understand what your kidneys actually do, because most people vastly underestimate how critical these organs are. Your kidneys are 2 bean-shaped organs, each about the size of your fist, located on either side of your spine, just below your rib cage. Each kidney contains about 1 million filtering units called nephrons. Blood flows into these nephrons under pressure, and as it passes through, waste products, excess water, and electrolytes are filtered out into urine, while essential substances like proteins and blood cells are kept in the bloodstream. This filtration happens continuously, 24 hours a day, processing about 180 litres of blood and producing about 1 to 2 litres of urine daily. But filtration is just one of your kidney's jobs. They also regulate your blood pressure by controlling blood volume and producing a hormone called renin that constricts blood vessels when pressure drops. They balance electrolytes, particularly sodium, potassium, calcium, and phosphate, keeping them within the narrow ranges your body needs to function. They maintain your blood's pH by excreting acid and retaining bicarbonate. They produce erythropoietin, a hormone that signals your bone marrow to make red blood cells. And they activate vitamin D, which is essential for calcium absorption and bone health. When kidney function declines, all of these processes start breaking down. Waste products like urea and creatinine accumulate in your blood, creating a condition called uremia. Fluid balance becomes disrupted, leading to swelling or dehydration. Electrolytes become dangerously unbalanced. Blood pressure becomes difficult to control. You become anemic because you're not producing enough erythropoietin. Your bones weaken because vitamin D isn't being activated properly. And toxins that your kidneys normally clear start affecting other organs, particularly your brain and heart. The insidious part is that kidneys have tremendous reserve capacity. You can lose half your kidney function and still feel completely normal, because the remaining nephrons compensate by working harder. Symptoms don't typically appear until you've lost 60 to 70% of function, which is why chronic kidney disease is often called a silent killer. By the time you notice something is wrong, significant damage has already occurred. Now let's talk about the 6 warning signs that your kidneys are failing. The first warning sign is changes in urination, and this is often the earliest signal people notice. Your kidneys produce urine continuously, and changes in the frequency, volume, colour or appearance of your urine can indicate kidney problems. Needing to urinate more frequently, particularly at night, can be an early sign. If you're waking up 2, 3 or 4 times per night to urinate, which is called nocturia, and this is new for you, it's worth investigating. It can indicate that your kidneys are losing their ability to concentrate urine properly. You may also notice that you're producing more urine than usual, or conversely, much less urine than normal. Reduced urine output is particularly concerning because it suggests your kidneys aren't filtering blood effectively. Changes in urine colour matter too. Dark urine that looks like tea or cola can indicate the presence of blood or excess waste products. Foamy or bubbly urine that doesn't dissipate quickly suggests protein is leaking into your urine, which is called proteinuria, and is a classic sign of kidney damage. Healthy kidneys don't let significant amounts of protein through their filters, so if protein is appearing in your urine, it means the filtering membranes are damaged. You might also notice a strong, unusual smell to your urine, or difficulty starting urination, or a feeling that your bladder isn't fully empty after urinating. The second warning sign is swelling, which is called edema, and it typically appears in your ankles, feet, legs, hands, or face. When your kidneys aren't removing excess fluid effectively, that fluid accumulates in your tissues, particularly in areas where gravity pulls it down. So your ankles and feet swell by the end of the day. You might notice that your shoes feel tight, or your socks leave deep indentations on your legs. You might see puffiness around your eyes, especially in the morning. Your hands might feel swollen, making it difficult to remove rings. In more advanced cases, fluid can accumulate in your lungs, causing shortness of breath, or in your abdomen, causing abdominal swelling called ascites. Now, some degree of ankle swelling after standing all day can be normal, particularly in hot weather or if you've been sitting for long periods. But persistent swelling that doesn't improve with elevation, swelling that's getting progressively worse, or swelling accompanied by other symptoms on this list is a red flag that needs medical evaluation. The swelling from kidney problems is usually symmetrical, affecting both legs or both hands equally, and it pits, meaning if you press on it with your finger, it leaves an indentation that takes time to bounce back. The third warning sign is persistent fatigue and weakness that doesn't improve with rest. When your kidneys fail, you become anemic because they're not producing enough erythropoietin to stimulate red blood cell production. Fewer red blood cells means less oxygen being delivered to your tissues, which causes fatigue, weakness, difficulty concentrating, and feeling cold all the time. You might find that tasks that used to be easy now leave you exhausted. Climbing stairs becomes difficult. You need to rest frequently during the day. You feel like you're moving through fog mentally. This isn't the normal tiredness that improves after a good night's sleep. It's a persistent, overwhelming fatigue that's present even when you're well rested. The buildup of waste products in your blood also contributes to this fatigue. Uremia makes you feel generally unwell in a way that's hard to describe, a malaise that affects your energy, your mood, and your ability to function normally. The fourth warning sign is persistent itching, dry skin, or changes in skin color. When waste products accumulate in your blood because your kidneys can't filter them out, they can be deposited in your skin, causing intense, unrelenting itching. This is different from normal dry skin or seasonal itching. It's a deep, crawling sensation that's difficult to satisfy by scratching. It's often worse at night and can be severe enough to interfere with sleep. You might also notice that your skin looks different. It can become very dry and flaky despite moisturizing. You might develop a greyish or yellowish tint to your skin, particularly if you're also anemic. Some people notice darkening of the skin or easy bruising. These skin changes happen because uremia affects skin cell turnover and because anemia reduces the healthy colour in your skin. If you've developed persistent itching that doesn't respond to moisturizers or antihistamines, particularly if it's accompanied by other symptoms on this list, kidney function needs to be evaluated. The fifth warning sign is a metallic taste in your mouth or ammonia breath. When urea, which is a waste product your kidneys normally excrete, builds up in your blood, it can be broken down by bacteria in your mouth into ammonia. This creates a distinctive ammonia-like smell to your breath that other people can sometimes notice. You might also experience a persistent metallic or bitter taste in your mouth that makes food taste different or unappetizing. Many people with advancing kidney disease lose interest in food, particularly meat, because the taste changes make eating unenjoyable. This is different from a temporary bad taste from poor dental hygiene or eating certain foods. It's a persistent alteration in how things taste that doesn't go away with brushing your teeth or using mouthwash. If food suddenly tastes metallic or wrong, and you're experiencing other symptoms on this list, it's worth getting your kidney function checked. The sixth warning sign is nausea, vomiting, or loss of appetite that persists for more than a few days. As waste products accumulate in your blood, they can affect your digestive system, causing nausea that's often worse in the morning. You might feel full after eating very little. You might lose your appetite entirely and start losing weight unintentionally. You might experience frequent vomiting without an obvious cause like food poisoning or stomach flu. This happens because uremia irritates the lining of your stomach and interferes with normal digestive function. Combined with the taste changes, many people with advancing kidney disease struggle to eat adequate calories, which accelerates weight loss and muscle wasting. If you're experiencing persistent nausea or appetite loss without an obvious explanation, particularly if it's accompanied by any of the other warning signs, kidney disease needs to be ruled out. Now here's what makes these warning signs so easy to dismiss. They're all vague. They're all symptoms that could be caused by dozens of other conditions. Fatigue could be from poor sleep, stress or depression. Swelling could be from standing too long or eating too much salt. Nausea could be from a stomach bug. Itching could be from dry skin. That's why kidney disease is so often missed until it's advanced. People explain away the symptoms as something else, and by the time they're severe enough to demand attention, significant kidney damage has already occurred. But here's the key. If you're experiencing multiple symptoms from this list simultaneously, kidney disease needs to be investigated urgently. One symptom in isolation might not be concerning. 2 or 3 together are a pattern that suggests something is wrong with your kidneys. Okay, so if you're watching this video, you're probably concerned about kidney health, whether for yourself or someone you care about, and you're looking for real information that could make a difference. I just want to take a few seconds here to remind you that I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest research, to help you live longer and avoid the preventable diseases I see in the emergency department every day. All I ask in return is that you give this channel a chance and hit the subscribe button to help me reach more people like you. If you get to the end and didn't think it was worth your time, feel free to unsubscribe, but if you give me your attention, I'll give you everything I've learned from over a decade in medicine. So please help me out and hit that subscribe button. Let's continue with the video. So what do you actually do if you recognize these warning signs? The first step is to get your kidney function tested immediately, not next month, not when you get around to it, but as soon as possible. Kidney function is assessed through 2 simple blood tests and 1 urine test. The blood tests measure creatinine and urea, which are waste products that accumulate when kidneys aren't filtering properly. Your doctor uses your creatinine level along with your age, sex and race to calculate your estimated glomerular filtration rate, or eGFR, which is the standard measure of kidney function. Normal eGFR is above 90, stage 1 kidney disease is eGFR above 90, with some kidney damage present. Stage 2 is eGFR 60 to 89 with kidney damage. Stage 3 is eGFR 30 to 59, which is moderate kidney disease. Stage 4 is eGFR 15 to 29, which is severe kidney disease. And stage 5 is eGFR below 15, which is kidney failure requiring dialysis or transplant. The urine test checks for protein and blood in your urine, both of which indicate kidney damage. If these tests show reduced kidney function or abnormalities in your urine, you need to see a nephrologist, which is a kidney specialist, for further evaluation. They'll likely order additional tests including imaging of your kidneys and possibly a kidney biopsy to determine the cause of the kidney damage. The second critical step is to identify and address the underlying cause of kidney damage. The most common causes of chronic kidney disease are diabetes and high blood pressure. If you have either of these conditions and they're not well controlled, you are at high risk for kidney disease. Tight control of blood sugar and blood pressure can slow or stop the progression of kidney damage. Other causes include autoimmune diseases like lupus, chronic infections, inherited kidney diseases like polycystic kidney disease, prolonged use of certain medications, particularly NSAIDs like ibuprofen, and obstructions like kidney stones or enlarged prostate. Identifying the cause allows for targeted treatment that can preserve remaining kidney function. The third step is to make dietary changes that reduce the workload on your kidneys. This typically means limiting protein to reduce waste production, limiting sodium to control blood pressure and reduce fluid retention, limiting potassium if your levels are elevated, limiting phosphate to prevent bone disease, and ensuring adequate but not excessive fluid intake. These dietary changes need to be tailored to your specific situation based on your lab results. So this is something you work out with your doctor or a renal dietitian, not something you try to figure out on your own. The fourth step is to protect your remaining kidney function by avoiding things that can worsen kidney damage. This means avoiding NSAIDs like ibuprofen and naproxen, which can reduce blood flow to the kidneys. Avoiding dehydration, which stresses the kidneys. Being cautious with contrast dye used in certain imaging studies, which can be toxic to damaged kidneys. Avoiding nephrotoxic medications and supplements. And treating any urinary tract infections promptly, because untreated infections can spread to the kidneys and cause further damage. You also need to manage your blood pressure aggressively, because high blood pressure both causes kidney damage and is worsened by kidney damage, creating a vicious cycle. The fifth step is to monitor your kidney function regularly. Once you've been diagnosed with kidney disease, your doctor will want to check your kidney function every few months to assess whether it's stable, improving, or worsening. This allows for early intervention if things are declining. And finally, you need to prepare mentally for the possibility that kidney disease may progress despite your best efforts. Not everyone progresses to kidney failure, particularly if kidney disease is caught early and the underlying cause is addressed. But some people do progress, and if that happens, you need to understand your options. Dialysis, either hemodialysis where your blood is filtered through a machine 3 times per week, or peritoneal dialysis where fluid is infused into your abdomen to draw out waste products. Or kidney transplant, which offers better quality of life and survival than dialysis but requires finding a suitable donor and taking immunosuppressant medications for life. In emergency medicine, I see kidney failure in its most acute forms. I see people who've had sudden kidney injury from dehydration, infections or medications, where kidney function drops dramatically over hours or days. With aggressive treatment, many of these people recover their kidney function, but not all. I also see people with chronic kidney disease who come in with life-threatening complications. Pulmonary edema, where their lungs are so full of fluid, they can't breathe. Hyperkalemia, where their potassium is so high, they're at risk of cardiac arrest. Uremic pericarditis, where the lining around their heart is inflamed from waste products in the blood. Altered mental status from uremia affecting their brain. These are devastating situations, and what's heartbreaking is that many of these patients had warning signs months or years earlier that were dismissed or ignored. Swelling they attributed to standing at work. Fatigue they blamed on getting older. Changes in urination they didn't think were important. If those warning signs had been investigated, if kidney disease had been diagnosed early, many of these emergency situations could have been prevented. I've also seen the success stories patients who caught kidney disease at stage 2 or stage 3, worked with a nephrologist, controlled their blood pressure and blood sugar, made dietary changes, and maintained stable kidney function for years or decades. Their eGFR stopped declining, they avoided dialysis, they maintained their quality of life. Those outcomes are possible, but only if kidney disease is recognized and treated early. Once you're at stage 5, once you need dialysis or transplant, you're managing kidney failure, not preventing it. The time to act is when you first notice the warning signs, not when they've become unbearable. Your kidneys don't give you many chances, they fail silently, and by the time symptoms are obvious, the damage is often irreversible. But the warning signs are there if you know what to look for. Changes in urination, swelling that doesn't resolve, persistent fatigue, unexplained itching, metallic taste or ammonia breath, and persistent nausea or loss of appetite. If you're experiencing any combination of these symptoms, get your kidney function tested now, not next month. Now, because early detection is the difference between managing a chronic condition and facing dialysis or transplant. If there's one thing I want you to take away from this video, it's that kidney disease is common, it's serious, and it's often preventable or manageable if caught early. You have more control over your kidney health than you might think. Controlling blood pressure and blood sugar, staying hydrated, avoiding nephrotoxic medications, and paying attention to warning signs can preserve your kidney function for life. But you have to act when the warning signs appear, not wait until they become impossible to ignore. Your kidneys are filtering your blood right now, and they'll keep doing that job until they can't anymore. Protect them while you still can. Please subscribe to this channel if you found this useful to help me reach more people who deserve this information. Thanks for watching, and I'll see you in the next one.